this Global Health YouTube channel. We're talking about the global health landscape today. This is a live stream, so we're going to give people a couple of minutes just to join in. But what I'm going to do is I'm going to right off the bat tell you what to expect in this episode. Really, when we talk about the global health landscape, we're talking about why we're talking about this is if you're looking for a job in public health or global health, you need to know where to look, what kind of organizations to keep an eye open for. And I've often spoken to people that are looking for jobs, and I ask them like, well, what have you got in mind? Where are you looking? Who are your sort of candidate organizations? And they typically come up with like 3 or 4. And I'm thinking, look, if you can hunker down and you know what you're interested in, and you've got a framework to think this thing through, you can come up with a list of like 30 or 40 organizations and then narrow that down to, to a handful that you're really interested in and put in a strong application to places that you might want to work. So we're talking about understanding who is doing what in the global health landscape so that you can get a job that firstly overlaps with what you're interested in, secondly overlaps with your skill sets, so they want you, as well as you wanting them, and thirdly, of course, that is in a location that works for you. None of us want to go and work in Antarctica. Well, actually, I shouldn't say none of us. There probably are people that do want to work down there for some strange reason, despite the cold. Right. So I'm also going to talk you through a framework that I've developed for thinking about the global health landscape, right? And that framework, and we're going to get into that quite quickly in the episode, it just breaks things down into thinking through organizations in terms of their focus, their function, their type, and their location, right? And I'm going to break that down for you. You're going to understand it perfectly. And once you've got that in your head, you're good to go. You'll be rocking. Okay. So this, just to reiterate, this is a live show. It's streaming over LinkedIn, Facebook, Twitter, and YouTube. Of course, it'll be available to watch in the future on YouTube and those other platforms. So you might be watching this in the future at some point. If you are, you can still put in comments. If you're watching live, you can ask questions, and we're going to try and respond to those questions. So stick questions in, and my colleagues and co-hosts here, Kale, Ellen, and Jovana, they're going to just keep an eye out for good questions, and we'll sort of answer as many of them as possible. But if you're watching this in the future sometime, you can put in a comment, and we'll try and get to those as well. The fact that you're watching this means you might be interested in jobs in the global health space. So consider becoming a member of my YouTube channel. You have to hit the join button. If you do that, you get access to special information about jobs. It's mostly about jobs and careers and CVs and job applications and how to prepare for interviews, et cetera, et cetera. And I also keep that community up to date with current jobs that are being advertised in the global health space. So think about that. There's a link in the description below. You can click on that. Right. Also, a special welcome to students from UCD. I know that there's students in UCD, which is here in Dublin down the road. I could throw a stone and hit you guys that are watching this video. You guys, please throw in your questions. I'd love to interact with you. Thank you, Jovana, Ellen, and Kale for joining in. Hi, guys. Good to have you with me.
Hi.
Hi.
Jovana hasn't been here before, so she's new to the team, and she is in Serbia. Hooray! And that's a place that I've been, which I like a lot. Okay, I'm going to talk to Jovana specifically in a little while about an organization that she is in charge of and runs. And what are you, Jovana? You're the president? I like that, president.
Yeah, actually, I'm a president.
That's what you want. That's what you want. So we're going to come back to that. In the interim, just to kick things off, I am just going to share my screen with you and talk you through this framework, and then we can get into questions and discussions and get people's thoughts and ideas, et cetera, et cetera. So you can see my screen. This is the framework that I use when I think about the global health landscape. We've got 4 quadrants: focus, function, type, and location. What do I mean by these things? When you think about the global health landscape, you're trying to think about the organizations that are working in this space. You want to think about, firstly, what do organizations focus on? And they may focus on a specific disease, HIV, TB, malaria, diabetes, or an exposure, alcohol, tobacco, poverty. Population groups, so it might be the elderly or homeless people or refugees, et cetera, disciplines. So by that we mean some organizations focus on health policy or epidemiology, or they may have a particular focus in a very special health economics, for example. Or it might be issues, and by issues I mean that there are things like climate change and health, gender and equity in health, human rights and health, that sort of thing, trade and health, et cetera, et cetera. So there's issues. So what is this organization focused on, right? And that's quite important for you. You need to think about, what am I interested in? what area of focus would I like to work within? You might want to work in a particular disease area. You might know a lot about HIV or TB and you want to get into that. Or you might have a skill set that's really kind of about a discipline. You might be a really strong health economist, for example, and you want to work in an organization whose focus is health economics, for example. Okay, so you think about the organizational focus. Then think about their function, right? And what I'm getting at here is break this down. Like, let's say you've chosen HIV, right? Then we move on to function and we say, well, within the HIV world, let's think through what organizations there can be. And when you start thinking it through, you might just only think of one or two, but when you think it through in terms of the framework under these headings, you'll start finding more and more and more. So function, there are funding organizations. There are research organizations. Those are usually universities, but not always. There are organizations that function in terms of governance, like the WHO. There are organizations that do product development, right? And sometimes that's big pharma, but it might not be. There's some public-private partnerships that work on product development. Product development can also be about access to medicines. So they may have a function like an organization like Unitaid that really provide finance to try and promote the inclusion of new products into the HIV, TB, and malaria space. And actually, they've moved beyond that. They're getting involved with all sorts of things. They're a fantastic organization. Health system strengthening, relief, and clinical support, right? So relief, I'm thinking about like MSF, they parachute people in when there's an earthquake. Clinical support, there's some organizations that actually go in and provide actual doctors and clinicians to help in hospitals in rural areas, perhaps in low and middle income countries. Right, that's focus, function, type. Now we're talking about, and this is kind of interesting. It's just a way of like breaking things down. We've got supranational, multilateral, bilateral, NGOs, private sector, and PPPs. Let me just explain what I mean by those things. Supranational, we're talking about organizations that are transnational, supranational. These are usually UN agencies. So it's the WHO, UNAIDS, Unitaid, UNICEF, UNHCR, et cetera. Or it could be, so those are the UN agencies, but it also includes like the World Bank and the International Monetary Fund and a couple of others. Sorry, my phone rang. I just had to go contact that call. So those are the supranational organizations. They don't fit within any particular nation state. They're located in a country. Their head offices are often sort of maybe in Geneva, but they don't fall. They're not a Swiss NGO. They're supranational, right? They also don't fall under the legal jurisdiction of any particular country. So you can't, for example, like sue the WHO, and they can't sue you. Then they don't exist within the framework of any legal structure. Multilateral and bilateral organizations. Multilateral just means between many countries. So that's, for example, the Global Fund. Bilateral, something like DFID, which is an aid agency from a particular country, like the UK in the case of DFID. And they have relationships with respect to aid and health and development with particular countries. So that's what we mean by bilateral, two countries. NGOs, non-profits, right? You know what those are, and NGOs can be local or global. The private sector, don't forget about the private sector. I know a lot of people working in the global health space and the public health space, working for private companies, doing good work, and they have very, very fulfilling careers. That could be pharma, it could be one of these consulting companies like McKinsey or Bain or Boston Consulting, and there's many others, and they do. And so don't write that off. I know a lot of people in public health don't think of the private sector as a place that they might work. It is a good place to look for a job, and I think you in the private sector, you learn a skill set that you can bring back into public life, which is tremendously useful. So don't knock it. And PPPs are public-private partnerships. Right. The final quadrant is location. And that, I mean, global, national, local, right? So you might work at a global organization like the WHO or UNICEF. National, it could be, like I do. I work for the Health Service Executive in Ireland, so it's the national health program here. Or local, you could work for an NGO that are providing a service to a community at a local level. The reason I've got location in here isn't just that you need to think through the different organizations that exist at these different levels, but you also need to be thinking about where it is that you want to live and work. Okay, so if you're a certain age, you don't mind, you can travel, we'll travel. You can pick up a suitcase and head off into any part of the world and you're quite happy. As your life unfolds, you may want to settle down, have a picket fence, a tree, and a couple of kids, and then it becomes a little bit more difficult to be as mobile as that. You need to think about where it is in terms of your life you are and where you want to be in the next few years, and think about location in terms of what works for you. Okay, so think about location. It is one of the factors that you need to keep in mind when thinking through jobs. Okay, I know I sped through that really fast, but I think we can turn this into more of a discussion. And so let me stop there and ask Kale, Ellen, Jovana, or anybody in the audience, any questions, thoughts, comments, pontifications, suggestions? Kale, you've identified a question from the audience.
Yeah. I just saw a good question come up then from Maeve, I believe it is. So it looks like Maeve has a background in international development and currently doing a master's of sustainable development, and they're wondering about whether they could work in the global health space, particularly in HIV/AIDS, with that kind of background.
Yeah, I mean, the short answer is absolutely. The funny thing is, I get that. I'm glad that question came up, because that kind of question comes up all the time in conversations that I have with people about working in global health and public health. They sort of say, well, I have this background, could I get a job in global health? And the truth is, you wouldn't believe the diversity of people working in public health and in global health. I mean, it's quite remarkable. Firstly, people make the mistake of thinking that it's all doctors. It isn't. There are doctors working in global health, and that's great, and I encourage doctors that are interested in this to do that. But there's actually very few people that are doctors. Most people come from some other discipline. Maybe you've got a master's in public health or master's in epidemiology, and that's a great stepping stone into the space. Or, I mean, you may have a master's or some sort of educational background in development or economics. All of these fields all get used, I mean, depending on the organization that you're talking about. And it could even be, I mean, when I worked, for example, at the WHO, I worked in a team. Who was on that team? We had people that were doing finance, people that were interested in innovative finance and finding better ways to get money into projects to save people's lives. We had people interested in economics, thinking through the supply and demand of products, access to medicine, procurement, supply, transport, inventory management, distribution. I mean, there's all of these. You don't think of these things when you think about global health. There was a small handful of us that had a real background in clinical medicine. In fact, maybe only 2 or 3 in the whole organization. Another subset that had specific training in public health, and then a whole lot of people that communications. There were communications people that were working with us. Logistics. We had logistics in there. There's almost. I mean, I often say to people, there's almost no career that you've currently got where the skills that you've got can't in some way overlap with the need that exists in the public health space. So that's a long way of saying, whatever you're doing, yes, we want you. There's a place for you. There's a way that you can add value. That was a long-winded response. It could have been much shorter. Sorry. Any other questions? Anything else that's popped up that might be interesting from the audience? I see questions scrolling through. Some of them are saying hi.
I think, Greg, sorry, a good question kind of going on from that. Dr. MJ Wesley here has said, do you think there's a better chance to get into the global health sector with Masters of Public Health on the background of medical training? And I think you're probably quite adept to answer that, given your experience. I think you would have seen there's probably the doctors, but there's also public health doctors. There's also all sorts of people in the global health sector. Sorry, Greg, can't hear you.
Through the options. Firstly, you've got a clinical background. You could add value just as you are, as a clinician, working for an organization that are providing a clinical service, right? So let's say you're a surgeon. MSF will put you in a plane, give you a parachute, and drop you into a war zone tomorrow to provide that service. Okay, and they won't need you to have anything else. They'll be like, you got a scalpel, will travel, please go. So, and it's not just surgeons, right? I mean, the world is full of problems. There's diabetes. There's all sorts of things out there. I mean, I remember when I was working in Ghana, at that point in time, there were only 3 urologists, qualified urologists in the whole of Ghana. The hospital that I was working with, there was an obstetrician. It was one of the biggest hospitals in Ghana, and she was the only obstetrician in that hospital. Like if she took 8 days leave, there wouldn't be obstetric care available for people. And I actually had a team of people that were great that worked with her. But so number one, you're a clinician. Will travel can work, absolutely. Firstly, secondly, you might be a medical doctor, but you might not want to be working as a clinician in the global health space. In that case, getting a master's degree of some shape or form will absolutely help you. It doesn't have to be a master's in public health. An MPH is great because it's nice and general and you can use it as a stepping stone to almost anything. But you might sort of say, look, I'm actually interested in epidemiology. Do a master's in epidemiology. That is not going to be held against you. Or you might be interested in statistics, or you might be interested in development, or health policy or health economics. When you apply for these jobs, usually the job adverts, if they ask for an MPH, they'll usually say we're looking for somebody with an MPH or equivalent. And they're basically saying we want some sort of postgraduate degree, but it doesn't have to be an MPH. And then a lot of people ask me, should I do a PhD? There's only two routes in which I think you need to do a PhD. The one is if you are interested in academia. So you want to work in a university environment and get involved with research in the medium to long term, right? A PhD is really a stepping stone into a world of research. So if you want to get into research, then you have to get a PhD. There's not really, that's almost like a prerequisite. Will a PhD increase your chances of getting a job like at the WHO or an NGO? Some of the time, yes, if the job you're applying for is very laser focused on a very technical issue that you've spent years getting a very, very specific skill set and knowledge base around. Those kinds of jobs are kind of few and far between, and when one comes up, it's a roll of the dice whether or not you're going to get it. You may or may not. There might not be another one like that for a long time, and there might be somebody else that's as qualified with more experience that gets it ahead of you. So that's a little bit of a gamble, but there are people with PhDs that are like sort of policy advisors, for example, on very sort of laser focused issues. Also, you got to think about the time commitment and the opportunity cost. So if you spend 4 or 5 years doing a PhD, none of that, if you're applying for a job at the WHO, gets clocked up as experience, by the way. And one of the big things that they always ask for with WHO jobs, if you look at the applications, they don't often ask for PhD graduates. They sometimes say it would be nice, an optional extra, but they certainly want to see years of experience clocked up. That's kind of one of the biggest things. And it's especially a non-negotiable with respect to where you land up in the sort of hierarchy of the WHO. So you can't apply for a P4 position unless you've got exactly this number of years of experience. And there's no bending that rule. Like 1 day short, bam, not okay, you're off. So, there's an opportunity cost in doing a PhD as well. I don't know if I answered that question well, or if I even answered the question. I can't remember what the question was. Sorry, Kale.
Oh, no, I think it was answered well, don't worry.
Any other questions? I see there's a couple of things.
Yeah. I actually have a question, and I also found a comment that I would like to comment.
Okay.
Somebody wrote that, in order to get a job in private sector, you always need experience. But I got a job in private sector without experience. But so I think it's a matter of perspective what you see as relevant experience, because I did a lot of volunteering while I was a student, in NGOs or projects. So there's always something that you probably have done, but you're not maybe perceiving as relevant experience. So
That's true. That's a very good point. And the other thing about experience, people often say to me, especially when they're thinking about entry-level jobs, like how do I get that entry-level job, which in of itself seems to require experience, but I haven't had a job. So how do I get the job that I need to get the experience to get the job? There's that kind of and something that I often say to people is this: there are ways to clock up experience without formal employment, right? And I think Jovina kind of was alluding to that. You can very often do volunteer work, you can do internships, but you can also, you can start a blog, and start creating a community around a particular issue. You can start a YouTube channel, you can create a podcast, you can write papers, and try and publish in journals or publish on other people's blogs. Or there's things you can do to just get involved and be part of what's going on in the global health space that'll give you visibility. And under certain circumstances, you can actually clock up as actual experience that goes onto your CV that you got outside of formal experience. I mean, a good example is, I many years ago started the journal Globalization and Health. Now, the years that I've worked as the chief editor in Globalization and Health, that can't really be clocked up as time that contributes to a job application. Like, so when if I was trying to fill in a job application at the WHO and they want to see years of work experience in a particular stream, I couldn't use the time that I've worked as the editor-in-chief of Globalization to contribute to that, because they're asking for professional experience in a sort of formal employed context. But you can put that onto the application as experience that you've got. You can bring it up in an interview as experience that you've got, and it definitely does add value. I remember when I was working at the WHO, I was hiring somebody to join my team, and there were two sort of final candidates that we were like looking at, and the one person had just done something really incredible in her own time outside of formal employment that sent a very strong signal that the subject matter was something she was personally passionate about. It wasn't just about a day job that she was doing for the money. And in my mind, that was kind of the clincher. So find experience sometimes outside of the context of formal employment, and that can contribute to your job application process.
Definitely. I just wanted to add that's been very helpful for me as well in the past. I don't think I'd be where I got to today without the volunteering. So I can definitely advocate for volunteering as a very good way to build up your skill set.
Thanks for that, Kale. Now, Yavna, I have a question for you. Would you tell us a little bit about CGHI? This is an organization, and I like to call you the president, El Presidento. But you are the president of CGHI, and I always have to kind of make sure that I say that correctly. But it's a really interesting enterprise, and I wonder if you could just tell everyone a little bit about that.
Sure. Well, while we are at the volunteering part, so CGHI, aka Coalition for Global Health Innovation, is a baby nonprofit organization, and we're committed to building a think and do tank, and also like a community and a platform for early career professionals within the field of global health and human development, where they can turn their ideas into solutions through teamwork, collaboration, and peer support. And this project kind of originates from the Multipod Mentoring Program, which is a phenomenal mentoring program for young students and professionals within global health. So check that out too. But while we are at the CGHI part, I just want to say that we function on two levels. We have an organizational level, and then we have a community level. And while we're at the organizational level, that's like where we lead the organization and kind of trigger the projects and everything else. But the community level is where people can join and they can kind of initiate their projects or start working on their ideas and figure out how can they actually turn that into a project and then to a solution to an actual global health problem. So feel free to reach out and find me on social media or CGHI on social media, and we'll be happy to connect. That's it. Oh, we lost Greg.
He's back.
Happy to have you back.
Reliably back.
Some patchy Wi-Fi over there.
I guess I'd like to ask Giovanna in Greg's absence then, what kind of projects do you have running at the moment?
Oh, good question. Pass. No, since we're just like registered and we're still in the like enrollment phase for the community and the project. So we don't have like any active projects, but what we're trying to initiate, like we want to start with some open discussions, which will we want to like have a topic or a question and then kind of figure out what can we as young professionals do together, because everything that we do is actually meant to be a call for action. So we want to brainstorm not on the things that are like far away or super like fictional, but actually what can we do? So yeah.
Okay.
Sorry, I think I disappeared for a bit there. I hope that wasn't too disruptive.
We pressed on, Greg.
Good. Thanks for that. Now, Jovana, a quick question. You called it a think do tank. I've never heard that before. That's great.
No, people actually like ask me if I kind of made it up, but it's a real word. Like it exists in Google.
Okay, I've never heard it before, so I love
the
it.
point is, like, we wanted to like put an accent on that do part because, as I mentioned before, we want to make a call to action and actually roll out like real projects. So that's why we underlined the do part.
Okay, brilliant. And listen, while I was gone for a few seconds, I don't know if you got a chance to say, but if you didn't, could you tell people where to find you online, on social media, et cetera, et cetera?
Yes. So you can just simply Google Coalition for Global Health Innovation, but also like our website is coalitionghi.org. And like we're present on Twitter, Instagram, Facebook, LinkedIn. So
okay, good stuff. Thanks, Jovana.
No problem.
Ellen and Kale, I know you guys did a bit of research jobs that are being advertised in the global health space at the moment. Maybe we'll just start with Kale. Kale, do you want to just highlight one or two of those just for people that are watching?
Sure. It was quite funny when we were answering Maeve's question earlier, actually, because one of the jobs I found in the searches was in public health, in global health, but very much not kind of your standard medical, clinical kind of even health background, really. So one of the jobs I found it's a specialist in creative partnerships. So it's advertised from the Global Fund. So the Global Fund is a very, very large organization, more than 100 countries, and they kind of advocate for health system strengthening. So with this specialist role, it is mainly focused towards someone with a background in communications and what was the other way? Public relations, and the role would be liaising with kind of celebrities and sports people and advocating for the goals of the Global Fund and trying to get kind of recruit people into the Global Fund's aims to be able to promote the things that the Global Fund are trying to do.
Okay, that sounds like a fun job.
Yeah. It sounds great. So there's a lot of stuff in the job description about developing a strategy to recruit celebrities and doing all the due diligence around the processes that will go from, contacting someone into the advocacy into even, talking points at meetings and that sort of thing for these people. The background for it is an advanced university degree in communications, marketing, public relations, or a related field, or a first university degree with 10 years of experience. So it is quite an advanced role, but it is all the essential requirements are very much focused around, organization, complex communication, planning events, and stakeholder involvement. So I thought it was really interesting kind of job to see come up in the global health space, and I think it's that it's a very broad kind of non-clinical experience that they're looking for. So I think it's a very relevant role to a lot of people who may think they're not, their skills aren't useful when they actually are.
Yeah, I like it a lot.
Right.
Ellen, over to you. Job to highlight for the day.
Yeah. So the one that I was looking at that I thought was quite a good one for starting out in the public health or global health space was Summer Associate for Health Global Programs at the Rockefeller Foundation. So the only thing about this one is that it is only open to those people who are able to work in the US. And it's also for kind of postgraduate. So you have to be kind of enrolled in a graduate program related to public health. But I thought that would be quite relevant, especially in the comments. I saw a few people asking, I'm in a NPH now, what do I do when I finish? So it could be a nice kind of springboard for finishing up after a graduate program. So yeah, I think the background is, as I say, kind of undergrad in public health or in something similar. And I thought the duties that they list in the job description were really relevant. And it's an interesting one because it's quite broad. So you get a lot of exposure to research. This particular role is kind of trying to research the scaling, testing, tracing, and vaccination initiatives as key to bending the curve for COVID-19. So obviously really topical. Yeah, and I also had a little sneaky look on LinkedIn of the people who have done this role in the past. And the types of people I came across were very much, very early career interns, research analysts, people who had done research assistant roles in university up to this point. So, it's obviously a really prestigious organization, but I thought it would be a really good one for someone who is in the position to work in New York and for such an amazing organization. And then, of course, I had to stalk the people who have done this role in the past and then went on to do amazing things. And a lot of them have become consultants for World Bank and, director of policy in various government organizations. So yeah, absolutely go for this one. And it's still open, I believe. So it's a really interesting one.
So that's a very interesting little piece of sneaky detective work that you did, which I'm very impressed at. And I like that you could have looked at where people that have been in that role before have gone on to, and what it is that they've gone on to accomplish. So that's really interesting. Thanks very much for that, Ellen. I like it a lot. I can't remember, somebody on the panel a few seconds ago made reference to the fact that MPH students often are thinking through, well, what am I going to do next? Mm-hmm. And my experience of that, just so that you know, when I was an MPH student, I remember the first people you go to ask, what should I do next, are all of your sort of professors and lecturers. Now, there's nothing wrong with doing that, but I can tell you now what they're going to tell you to do. And the reason is, everybody thinks that you should do what they did, because obviously they don't think that they made a mistake. You know what I mean? They had good reason. And so you will find that if you're in an academic environment and you speak to your lecturers and professors and you say, what should I do next? A lot of them will say, well, why don't you think of doing a PhD? Because for a lot of them, that is a natural career stepping stone. That's how they got to where they are. It made a lot of sense and it's paid dividends for them. And maybe the answer to that for you is, yes, that is what you want to do. You do want to see yourself in research, and that's the right thing to do. Some of your professors and lecturers may have actually had a career path that kind of takes them in and out of academia, and they may give you advice, that's broader than that. So I don't want to paint them all with the same brush. And if you are a professor or lecturer at a school of public health watching this, we love you guys. Don't ever change. This is not a slight against you. This is a slight against everybody, because I do the same thing. When people ask me, what should I do next? I'm always telling them, well, I think you should go do an MBA, because that's what I did. You know what I mean? And that's not the right thing for everybody. But it is true that everybody's going to give you the advice that you should kind of more or less do what they did. And that's a natural thing to do. So what I'm saying is, get advice from a diverse range of people, like ask around. One of the things you can do is on LinkedIn, you can reach out to somebody and say, would you mind me connecting with you sometime? I'd just love to ask you some career advice. And most people to a question like that will say, yes, of course. Nobody minds giving you a couple of minutes to give you advice. It makes them feel good and that they're making a contribution. And you're not asking them for like a day of their life. You're asking them for 10, 15 minutes. Okay, any other questions, thoughts, concerns, pontifications, or comments from our panel or from the audience? I think we've lost the audience questions, by the way. I think when I left and came back, there was some sort of technical glitch. So sorry to the people that are still typing in questions. I apologize we just can't seem to see the questions anymore. I'm not sure where to look because I'm not quite that familiar with this platform. So what I'm going to suggest is this: if we don't have any more questions or comments, we'll probably wind things down. This has been a lot of fun. Any other sort of final thoughts from Kale, Ellen, and Yavana?
Well, actually, I had one more question that I thought that we can go through briefly, but if we don't have the time, that's totally fine too.
We've got the time. We've got the time. Talk to us. Question.
This is coming from Michelle. Hey, how about how to switch within global health, for instance, from research to policy, but also from a research topic to another?
Okay, so I'll tell you what my thoughts on that is, but other people may have some thoughts as well. Firstly, research to policy is easy because you usually have deep technical knowledge on an area that you've been doing research in. Most and most policy decisions should be based on evidence and available research. So you're in a great position to add value in that sense. And you've got to sell yourself as a subject matter expert. And then moving into the policy space, I think is a natural, and a lot of people do that, by the way. So that's a natural move. Switching between research areas, also easy. I'll tell you why. Because when you develop skills in research methodology, that's a transferable skill. So I've got a good friend that spent most of his career working in the HIV space, and recently said, look, I'm going to swap over to climate change and health. That's the new issue of our time. He's taking a huge skill set that he's learned over the years. He's got over 100 publications in peer-reviewed journals in the HIV space, and he's just made a big switch. He's like, climate change and health, that's my new thing. But the skills are there. He knows how to do research. And so it was an easy transition. Needed to get up to speed on some of the sort of technical stuff and the language and the background science, but he's a bright guy and he's up to speed, and now he's cooking with gas. Kale, question from you.
Just on that as well, I've seen a question here from Soleimani, and I think kind of talking about that transition between different fields. They've asked, do you think that research or kind of field intervention, field knowledge is more important when applying for WHO jobs? That's a very interesting question about what I think, how transferable are the skills from that kind of thing into the WHO kind of positions.
So I think that it depends a lot on what the WHO position is that you're applying for. But for the most part, the answer, I think, is yes. If you've got field experience. In fact, if you look at job adverts, like particularly WHO job adverts, they will very often specify that they're looking for somebody with field experience. But again, it depends largely on what the job is that you're looking at. But having that real insight, up against the coalface insight as to what's happening on the ground, particularly in low and middle income countries, is absolutely invaluable, and I think that stands you in good stead. Kale, the second part of that, I'm not sure that I got the second part of the question. Can you just repeat that?
I think it was just kind of around whether, what's again, it depends on the job, but which is kind of viewed more positively, I guess, research background or field experience.
Oh, research or field experience. I see what you're saying. Okay, I got you. Okay, I think it would really depend on what the job is. Absolutely. But for the most part, and this kind of ties in with the previous question, if you've got a lot of research experience, then you're going to sell yourself to the job market as a subject matter technical expert. You know what I mean? You're gonna if you've got field experience, then you're gonna be coming in basically with that background knowledge and experience and know-how and transferable skills. The field experience, you can't apply for a job and make the field experience in and of itself your selling point, saying, oh, I've got field experience. It's field experience in what? And it might be that you've worked in a particular area in a country, and then you arguing that it's that in-country experience that's translated into a skill set and a knowledge that you can't get in books, and your value proposition is because you're coming with a deep set of insights. Ellen, question.
Yeah, a good question there from Alana Gannon there. So she's graduating from her undergrad in public health science, and apart from LinkedIn, where to look for jobs. So this is something I've come across as well when I was looking for a good job to speak about here. I was wondering, is there a public health job board, or is there somewhere that is in your mind as a go-to place for a good place to kind of research these types of jobs?
I haven't looked for a job in the global health space for so long. I can't remember where I used to look. Certainly, at the WHO, if you go to the WHO's webpage, there's, they advertise their jobs there. There used to be a website that I used to use called Relief Web. If you're interested in doing relief work, like working for MSF or one of these organizations that like sort of drop you into sort of human, places where there's a need for humanitarian aid, Relief Web was good for that. I think there's like a unjobs.org sort of webpage somewhere. If you do a search for like UN jobs, it'll come up with a webpage that sort of summarizes all the UN jobs, and that will include UNICEF, UNAIDS, WHO, etc., etc. So, but there are others. What I'm going to try and do is I'll make a little list and stick them up on my YouTube channel in the community section, and you'll be able to see it there. But I think that's a great question. Kale, you've got a comment on this subject.
Yeah. Because I've been someone in the past who's looked at these kind of jobs as well, and I know that Alana mentioned LinkedIn, and I find that going in LinkedIn and then looking at what the LinkedIn pages follow, leads you on a certain trail, and eventually you can kind of build up this network. And it's the same for Twitter. I find that's a good way to find people who are working in positions that are related to what you're interested in. But on Relief Web as well, you can sign up for updates on there. So twice a week, they'll send you a list of hundreds of jobs that are available in through an email alert, and it's for near every country in the world. You can search their database as well. So there's really quite a lot of stuff on there. And yeah, I think just finding organizations that are related to organizations you're interested in, and then just looking at their career boards will eventually give you this massive places to check every week or whatever you want to do.
Thanks, Kale. Yeah, and it has. I am going to try and create like a summary of good web sort of sites that you can look for jobs on, and just so that this isn't. I don't want to be like kind of pushing the sort of membership on my YouTube channel, but on my YouTube channel, the members have got access to a link that'll take them to a web page that keeps a running summary of current jobs in the global health space. Now, when I say running summary at the moment, I think we've only got 3 that are up there, but I'm going to be adding more and more and more to that. And there's a due date column on that spreadsheet that on that web page. And when the due date arrives, those jobs disappear off the board. So everything on that board is a current job that we've kind of looked at and identified and thought is interesting and stuck up on there. And actually, Kale and Ellen, the jobs that you created for me and you stuck onto the ClickUp board, that's actually where they go. Just I don't know if you knew that. They go onto a board, and I filter out things like your email address. Don't worry. Okay. Any other questions, thoughts, concerns, criticisms? Nothing. Well, I'll tell you what. Let's end it there. That's been a really fun episode. I really enjoyed chatting to you guys. As always, I think I learn a lot from the comments and questions and interactions. And keep the comments coming. Even if the episode ends, you can stick comments on YouTube and LinkedIn, and we'll try and get to those as well. Thanks everyone for watching. If you're watching this on YouTube, remember to subscribe, like, share, etc., etc. Join. Love you guys. Don't ever change. Don't do drugs. Always do your best.